Hi, everybody. This is Dr. Danish with the 50 Shades of Pain show. Today, what I wanted to talk about is posture and how posture influences back pain. Your mom always tells you, "Hey, don't slouch." There's a reason for that because your back is controlled by the muscles of your back, and good posture means that you're utilizing your muscles the way they were designed to be used. And it can be very protective because when we talk about back pain, what we're really talking about is a multitude of structures coming from muscles, bone, disc, joint, nerves, ligaments, tendons. All of these are involved in creating or promoting low back pain. So what I'm going to talk about is how that's the case. Why is it that the muscles of your back and your posture impact your pain? And what I'm going to do is use a presentation just for a few talking points. So this is somebody's back, hypothetically, just to give you visual context of where I'm talking about. It's this part of the back that I'm going to take a look at. And when you look at that part of the back, you've got a lot of different structures that can cause pain. So starting from the most superficial layer, there's the muscles and tendons themselves, particularly in this area here. That area is quite vulnerable to injuries and strains. Then if we take that away, you can see the bone underneath, which is going to have a lot of connective tissue, ligaments and such. And then there's the nerves deep to that, and the discs beneath that as well. And when we talk about posture, the main issue that we're looking at is the muscles themselves, how the muscles are holding the integrity of the spine together and creating stability. Because if you think about it, your spine has two really fundamental features. The first is to hold you upright so that when you stand, you can have a standing posture. But the second is to allow for all of this mobility. And that mobility is created by the adjustments of the muscles in your body, which go from being soft and resilient or bouncy so that you can move, to hard and stiff so that you create a column that creates that stability upright. So what would happen if we came through? I think of muscles as the suspension wires to your body, to your spine, because what they're doing is they're taking the load off of the pillars, which I kind of equate as the spine itself, the joints, the disc, the heart structure. So the suspension wires or the muscles are redistributing that load, kind of like what suspension bridge wires do. So when you look at suspension bridges, you've got the pillars that go into the water that create structural stability. You've got the two ends which stand on solid ground, but you don't have anything in the middle here. But the way that bridge is held up is with these suspension wires in between. And that's essentially what your muscles are doing, is creating that suspension to hold things together. Now, what would happen if I came through and cut all of these wires? Well, you would anticipate that the load would be too much in that center area and could make you vulnerable to injuries. Essentially, that area can start to crack and break down. And essentially, over time, what happens is that structures that weren't meant to hold the structure up start to break down, and eventually things collapse. So muscles are really key about keeping stability in the spine. And it doesn't take a long time for your muscles to start to deteriorate. So for instance, if I was to look at healthy muscle, there wouldn't be any gaps here. This would be a tight structure with really minimal. These are blood vessels going through it, but it would be a really tight structure without these infiltrations, what I call as fatty infiltrations within the muscle fiber. But it doesn't take a whole lot of time of immobility for that fatty structure to get worse and cause even further breakdown. And after just a few weeks of exercise, you can see that there are baby muscle fibers starting to grow within that fatty infiltration. So you can regain muscles of your back, but you can just imagine if you're not used to using your spine muscles to maintain your posture, they're going to start to break down and turn into have fatty atrophy. And while yes, that fat has stem cells, which can then replicate and become baby muscle cells, and those baby muscle cells will then grow and become healthy muscle tissue, your ability to do that as your age diminishes. So maintaining posture, good posture throughout your whole life, can maintain the structural integrity of those muscles and prevent that kind of fatty infiltration, which you then have to build up if you can do it, if your body has that capacity. And a lot of people tell me, well, I'm past my prime, I can't really build muscles anymore. And that's not true. You're constantly breaking muscles down and building them back up. So if you're able to do that on a constant basis, just naturally, then clearly your body has the capacity. We just need to help leverage that, the stem cells that are there, and get those muscles working again, get the incentive to those stem cells to start replicating into new muscle tissue. So to show you on an MRI what that looks like, let me show you what a normal MRI looks like. So a normal MRI would be something like this, where you can see the disc up front. This is just to give you an example. This is as if I were to take a slice of this person right through the middle. That would look something like this if I was looking right down the center of the body, where you have, this is the bone on the backside. To compare that, and by the way, this is Complete Anatomy, which is really good software. Little plug for them. So if you look at this structure right here, that's the equivalent of this bone right here if I were to look at it in cross-section, like if I was to look at it like this. That's what, there. So that view is essentially the same as this view right here, where this T structure is this bone right here, called the spinous process of your vertebrae. And looking back down into the center, this area here, now this is a cut through the disc, but I'm going to use the bone as an example. This would be that bony part right there, and then through the center is where your spinal canal runs. And then back here, let's bring everything back. I'm going to bring the muscles back on. So out in this area, that's where the muscles of your body lie, of your spine lie, and they're the ones responsible for maintaining posture and giving you the mobility that you need in your spine. Those would be the equivalent of these muscles right here. So let's go back to here. What would an abnormal MRI look like? One in which the muscles of the back have atrophied. Well, you can see the difference between the two of these, where this one shows black structures that indicate muscles, and there's a little bit of atrophy here, but it's not terrible. Versus this one, there's a lot of that fatty infiltration that I showed you in the previous pictures, where a lot of that muscle has broken down and become soft tissue that doesn't really have structural integrity. So the progression from mild atrophy, which just shows a little bit of white space around those muscles, to moderate atrophy, and then severe atrophy, and then really, really severe atrophy. These are clinically relevant. It's not stuff that is often discussed on an MRI neither by the radiologist nor the doctor who suggested or ordered the MRI. It's something that's often overlooked, but it's really telling about what's causing the person's low back pain. Because I know that if they have that kind of atrophy in the back, what's going to happen is you're going to see more and more pressure on the column of the spine. So first thing that happens is that other muscles try to compensate for it, but because they're not well coordinated, you start to lose the curvature in your spine. And essentially that creates a lever right here, or a pivot point right here in the low part of your back. And again, to give you orientation of where I'm looking, I'm going to take away these muscles. It'd be the equivalent of taking this view right here in this MRI. But what you can see happening is that this disc is starting to deteriorate. You can see it compared to these other discs. This disc is starting to deteriorate, and you can even see some swelling in the bone marrow of the bones above and below. And that's, you can attribute in large part to the loss of muscle structure and that soft tissue fatty infiltration that you get over time. The next thing that happens is that the ligaments in your body try to compensate for the lack of muscles, and this can go both ways. I mean, the muscles can also be somewhat compensating for insufficiency or weakness within the ligaments, but they will both have an effect on each other, and over time they'll break each other down, kind of like a domino effect. And when those guys break down, then the hard structure, the hard tissue, like that bone, the disc, then those structures need to see more stress, kind of like that suspension bridge, where if I cut the wires, the pillars and going into the water is what's gonna start to break down and see damage. So progressively maintaining or not maintaining your body posture will gradually accumulate weakness in your back and cause these problems to develop. So that is about it. Oh, what posture is important? What posture is healthy for your back? Well, if you look at a spine, there's a little S shape to it. Let's see if I can take away some of these bones. Nope. But I can hide this. Let's see if I can hide all of the ribs. No, just a few. So you can see that the spine has a nice kind of S shape to it. Oh, I guess I can't do all that. So yeah, full body. It has an S shape to it, and that's because this entire structure is working together to create essentially like a spring system in your body, so that your whole body is balanced evenly with the center of balance here, but that S shape is helping to absorb or bumps rather than having all the load on a single joint. The S shape redistributes that and makes your spine more like a spring. So posture will also help protect your back. If you have like an accident or fall, your muscles will intuitively contract in a way that protects you when you fall. So how do you work on posture? The ideal posture is one in which your chest is a little bit out. You're feeling some arch in this part of your back. You've got a lot of muscles that are often poorly utilized. So these muscles off to the side are really effective in distributing some of the load that your low back feels up into your mid back. And a lot of us have a hard time recruiting these muscles when we're standing or walking. And if you can focus on contracting those, like imagine there's a suspender from your mid-back down to your waist. Imagine trying to contract those muscles and leverage them more in creating that kind of suspension-like system in your spine. The next group of muscles that are really important and often get neglected are the abdominal muscles, the obliques, and you'd be surprised as to how much they're affecting your posture. But they create an anchor for the muscles of your low back to hold on to and create greater tension. And if your core muscles, everybody talks about your core, if your core is weak, then you're not able to give a counterbalance to the muscles of your spine. So they don't have anything to hold on to. And what will happen is they just kind of, your back muscles just don't have enough recruitment to maintain that posture, and you get that progressive domino effect of atrophy. So if you're not familiar with core exercises, there's a number of different techniques out there that can help get your core stronger, which is going to have an impact on your posture, which will have an impact on the stress that your spine feels, and will have a long-term impact on whether you develop low back pain or not. But if you are looking for some core strengthening exercises, you can look up Stuart McGill. I think he has 3 exercises that are really helpful for maintaining core strength. That would probably be my personal favorite. But there are others. There's a lot of different protocols for exercises that will maintain your core, which will then also affect your posture and influence whether you develop low back pain down the road or not. So we've got a few minutes left. I like to leave things open so that if anybody does have any questions, you can just chime in and ask if there are any questions about posture, about muscle control, how to maintain good posture, and why that affects your low back, or why that evolves into low back pain. Feel free to ring in, and we'll give it a few minutes. But if there aren't any questions, then we'll bring this chapter of 50 Shades of Pain to a close. If there are any local people watching, I wanted to remind you that on July 11th, we have an open house in the evening. Tops Magazine is going to be here. We're doing a Tops event, and there will be some really good food, and we'll have more information about what we do and how we can help people. So I encourage you to come and tell your friends to come. Again, that's on June 11th in the evening, so anytime after 6 o'clock. And if you go to our website, www.wellwardmed.com, there will be more information there, and we'd love to see you there. So I'm not seeing any questions from anybody, so I'm going to bring this to a close. Oh, looks like there is a question here. It seems like good posture. This is from Robin Maloney. Seems like good posture is a conscious effort as I age. I will be 60 next year. Well done, Robin. It is, posture is something that really does take work, particularly as we age. The reason that is, let me take a sip of water first, is that your soft tissue, these ligaments, let me go back to my screen and turn off my light. So getting rid of the muscles, you can see the ligaments, the soft tissue ligaments that sustain your spine. These ligaments, progressively as we age, they start to weaken. So when these ligaments start to weaken, the only thing that's guarding against stresses being focused on specific spots on your spine are the muscles. So you're right, as we age, it does take more conscious thought and effort to maintain maintain the structural integrity of your spine and maintain that good posture. And it's because they're having to do the work of two structures, the ligaments in your back as well as the muscles in your back. But the good news is that if you have a healthy diet and if you're working on your core, maintaining that conscious effort, then you can actually contract those ligaments and keep them strong. And if it really becomes a problem, that's when some of the regenerative techniques are helpful in restoring some of the integrity of those ligaments and tendons, as well as giving your muscles a head start in how they repair. Do I think regular chiropractic care is helpful with low back pain? I think there is value to chiropractics. Osteopathic manipulation is another form. Physical therapists do some forms of manipulation, but as we age and those ligaments start to lose their integrity, there is going to be some shifting and movement that a chiropractor can be helpful in readjusting, just as an osteopathic physician or a physical therapist can do that. And you will find a lot of different debates about this topic from different specialties, but I'm just speaking in a general sense. They can help in readjusting things, but what's absolutely important is for them to also educate you about the soft tissue muscles that would supplement or support the ligaments that seem to be losing their integrity, so that it doesn't continue to need adjustments or have that constant maintenance ongoing. If you can stabilize the structures of your spine that are causing the shifting, that's a long-term therapy as opposed to just constantly readjusting it back into place. I like the combination of some manipulation as well as regenerative therapies because it can help maintain the positioning that we want while the regenerative therapies are building up tissue and creating that stability. But regenerative therapies alone without any kind of exercise or rehabilitation can be a waste of money, because while yes, it can create greater stability, the body doesn't necessarily know what direction to build more redundant tissue or stronger tissue without stresses that help orient it to those directions. So Robin, that I hope answers your question. Thank you for chiming in. It sounds like you're going to go visit your chiropractor in Versailles, who is very good. That's great. If anybody has any other recommendations for a good chiropractor, please use this venue to maybe give some shout outs to the chiropractors in our community who are doing a really good job. If you're in Versailles, there's a physical therapist there at Court Physical Therapy I really like a lot. His name is James Escalani. And at some point, I'm going to have him on the show for him to talk to us a little bit about some of the things that he does. But he is an excellent physical therapist, and I know he does do some manipulations. Looks like Robin is recommending Dr. Rob Forey and James. I wonder if you're talking about James Escalani, the physical therapist I was just mentioning, but yes, it is. She's talking about James Escalani, and he's an excellent physical therapist. I would highly recommend him. And I'll definitely reach out to Dr. Forey and get to know him better as well. So if there are any other questions, please feel free to chime in. I'll give it a couple more minutes. But if nobody has any other questions, then we'll call it to a close today. So, So, all right. Well, thank you for chiming in, for tuning in, rather. Keep in mind, we do these shows on a bi-weekly basis, so I'd love for you guys to tell your friends, tell people to come in, because the more interaction there is, the more I'm able to help educate the community, which is one of the pillars to our practice. And I'd love to answer questions and help people understand their bodies better and how we can maintain or optimize the mobility and structural integrity of our bodies long into our later stages of life. And remember that we have I say that as I work on my posture as well. We have an open house on July 11th with Tops Open House. We'd love to see you there. And if we miss you, then hopefully we'll see you soon. Thank you for tuning in.